is City News everywhere.
Alberta in the midst of a crushing fourth wave of COVID-19, still weeks away from its expected peak. Premier Jason Kenney revealed Tuesday the projected worst-case scenario could see the province max out 380 ICU beds by the third or fourth week of October.
If we need to take additional measures, we will.
Those measures don't yet include accepting help from other provinces or the feds. Kenney says discussions there are ongoing.
The last I heard was perhaps 10 personnel, and that might add potentially capacity for 2 beds. We've asked that we want to also be aware, because it's a federal asset, about what other pressures they're looking at.
The province instead focused on creating more ICU capacity from within the system, despite calls from doctors and nurses to enact further restrictions.
This strategy that we've got right now is akin to saying we don't need firefighters or fire prevention strategies. We'll just build more burn units. That can't be the way we get out of this.
Kenney said he wants to wait to assess how the last round of measures fared before bringing in new ones.
Part of the challenge here is that the pressure in the hospitals is emerging from the unvaccinated 17%. They represent about 92% of ICU admissions. And I think by definition, we know that that group of the population is the least likely to comply with any public health measures. So it is a paradox. And there's no easy solution.
In the meantime, the government putting an end to protests outside Alberta hospitals by adding them to the list of critical infrastructure under Bill 1.
And exercising these opinions crosses the line into interfering with the ability of Albertans to access health care and the ability of our healthcare professionals to provide it, often in situations where every second counts. We must take action.
Offenders are looking at fines of $10,000 to $25,000 and possible jail time. In Calgary, Stephanie Lasuc, City News.